I'm really glad you raised that point. So let me just cite that of the 23 million Americans with substance use disorder, only 10% access treatment. So and the major barrier is stigma, the major barrier to treatment. Can you imagine if only 10% of my high blood pressure patients got treatment? That means the other 90% will be getting blind, liver failure, kidney failure, and dying of strokes and heart attacks. And by the way, I'd probably lose my medical license. But the 10% that are getting addiction treatment, we seem to be okay with that, and that's unacceptable. We need to really reduce the stigma, what John and Cassandra were talking about, and by doing so by changing our vocabulary, using words like substance use disorder, not substance abuser or drug abuser. Let's get rid of the war on drugs and other punitive, tough language. And don't say dirty urine, your urine is positive. So language like that, because it matters. And then also, we really need to expand access to life-saving medications like buprenorphine or Suboxone, Subutex, and methadone, and more recently naltrexone. These are medications that save lives. They do not substitute one addiction for another. Because this is pushback that I get all the time. So these are things that we need to do. And yeah, we need to absolutely increase the number of recovery beds, residential treatment beds, get more substance use counselors, case managers. We need to do a lot more of that. I'm hoping that more federal dollars will go towards treatment beds and services.